Good Friday afternoon to you all here from beautiful Jacksonville, Florida. I wanted to give updates on the COVID-19. I did this same thing last week and it worked really well. This is a way for me to get my opinion and my information out there so that the folks in the media don't have to keep calling me or sending me messages for it. So please feel free to use this in any way you want to and share it if you think it would be helpful. So a couple of things I want to touch on today is number one, why are we making such a big deal about COVID-19 when the flu clearly kills more people? And number two, are we truly flattening the curve and making this easier for everybody throughout the country by doing the social isolation or social distancing? And number three, why is everyone wearing a mask? So I'll start off with the flu. Yes, the flu definitely kills more people in this country, at least to this point, that's what it does. And it does cause more people to go to the hospital. But the reason it was so important and continues to be important for us to do what we're doing to minimize the spread of COVID-19 is because there are only so many hospital beds. This is all about not overutilizing the healthcare system, which in some parts of the country are already taxed to the extremes to begin with. And during the flu season, our hospitalization rates typically go up as it is. So you start to reach capacity. When you have a virus like this where there is no vaccine and no treatments, and it does typically affect elderly people and people who already have other chronic health problems, they too will then require hospitalizations. And before you know it, your hospital is overfilled with patients. This is an incredibly contagious virus, so it is very likely to spread amongst communities very quickly. For instance, there is right now, it appears that about 1 to 8% of people who develop COVID-19 are requiring hospitalizations. Here in Jacksonville, we've had 462 positive tests and 67 hospitalizations. That's about 8%. Okay, if you assume in a city the size of Jacksonville, where we have 1 million people, and let's say only a quarter of the people were to get infected without doing social distancing, we would have 250,000 people infected. If 8% of those people required hospitalization, that would be 20,000 people going to the hospital. We do not have that many hospital beds in Northeast Florida. So by socially distancing, doing what we have done by keeping kids out of school, closing down essential businesses, making sure we're not going to restaurants or sporting events and baseball games, we're doing the best we can at stopping the spread of a virus that does not have a vaccine and does not have a treatment so that we do not overwhelm the hospital systems. Why is that also important? Well, if the hospitals are completely full, what's going to happen to the 65-year-old man who has a heart attack? What's going to happen to the 18-year-old kid who has appendicitis or the 25-year-old who got in a bad car accident? They're not going to be able to go to our local hospitals. They'll have to go somewhere else, and it is certainly not the best way to provide care. So if all it took is for us to socially distance and do some of the things we've done to keep the healthcare system open for other people who may need it, then it's worth it. It certainly has taken its toll on the economy, but in the big picture, we're keeping people healthy and safe, and I think that's where we have seen great success through parts of the country, but here in Florida in particular. And I want to show you, a couple of things, why. So, this is where that term flattening the curve came from. Because if we're peaking with people infected very, very highly, very quickly, and 8% of them are requiring hospitalizations, you will go overnight from having a good hospital that has plenty of capacity to having a hospital that is overwhelmed very quickly. So the whole idea was to flatten the curve, make it so that we know people are going to be exposed and infected, but not let it spike so high that it completely destroys the healthcare system. And here in Florida, I think we've done a pretty good job with that. Here's the curve from the Department of Health site. This is about a month ago. And over the last month, you can see how the numbers went up, but there wasn't that big peak that would be like way up here. It went up and now the curve is flattening down. That's exactly what we wanted to see happen here in Florida. And as a result, we haven't seen the hospitals overwhelmed, at least not in most of the state. Here in Jacksonville, same story. Where we started to where we are now, we reached our peak in terms of number of positive tests, it looks like, on April 6th. And we have trended down since then. This is a very good example of flattening the curves. Our hospitals in Northeast Florida are not near capacity. So we've done a tremendous job of keeping people out of the hospital. And I credit all my brothers and sisters in medicine here in Jacksonville for doing that. But I credit the locals, the people in the community who have followed social distancing to make it so that the rest of us can stay healthy. We're all staying healthy together perfect example of how it makes a difference. So I think it's important to see that, yes, the flu does kill more people. This particular virus is more infective and contagious and does affect a lot more people more quickly. But by doing the social distancing, we're keeping people out of the hospital. The last thing is, why is everybody wearing a mask? That was another big question I got this week. And it's not because the cloth masks protect you from getting the infection. What I keep trying to tell people is to act like you yourself have the infection and you're trying to protect other people from getting it. That's really the best way to make sure that this doesn't spread. So you wear the cloth mask, you're less likely to spread the infection to other people, allows us to flatten the curve and keep people out of the hospital. I hope that this makes sense and I hope that this was useful. Feel free to direct message me or comment if you have any questions, and I'll try to get back to you as well. And remember, guys in the media, you can use this at any point in time, and I'll be happy to clarify anything I said. Okay, take care. Have a good weekend.